Hello. This Fern educational video discusses the care of emergency department patients with dizziness and vertigo, attempting to appropriately diagnose and treat serious central etiologies. We will be discussing nystagmus on bedside physical exam. My name is Ed Sloan. I'm with Fern.org. More about Fern to follow. So we will address the issue of nystagmus in patients with acute vestibular syndrome. A few caveats about nystagmus in AVS. The first is that nystagmus exam is related specifically to patients with acute vestibular syndrome, constant, new onset, severe vertigo symptoms. The nystagmus exam in patients in other clinical settings will vary such that the central versus peripheral tenets discussed here may not apply. The second caveat is that nystagmus is discussed first in the HINTS exam because the horizontal impulse test exam results only apply in patients who are noted having nystagmus. And then the third caveat is that if a patient does not have nystagmus in the setting of profound vertigo and ataxia, a central etiology should be suspected regardless of the HINTS exam itself. These caveats noted, let's discuss the following. When is nystagmus of a peripheral etiology? Horizontal nystagmus is commonly present in patients with a peripheral etiology to their vertigo. This nystagmus is one directional with regard to the horizontal movement that is fast. In other words, the fast correction is only in one direction, meaning that the other vestibular system on the other side is ill or non-functional. A central etiology is suspected when there's horizontal nystagmus is absent, that is, there's no nystagmus whatsoever. There's vertical or torsional, rotational nystagmus, or there's bidirectional horizontal fast nystagmus movement. In other words, a fast correction in both directions when moving the eye to one side or the other. This is more likely due to a central disease etiology because it's not likely that both vestibular systems on both sides will be sick at the same time. Here's a graphical representation of that. If you look at the figure and in the rectangle that is red, a central etiology is where there is fast movement for nystagmus in both directions, which is noted here in 2B. Other signs of central, as we discussed, horizontal nystagmus is completely absent. There is vertical or torsional nystagmus. So these are the central etiologies. So in conclusion, central etiology is if there is vertical or torsional rotatory nystagmus, if there is bidirectional nystagmus of the fast component in both directions, or no nystagmus is noted whatsoever. A peripheral etiology is suspected if there is only unidirectional horizontal fast nystagmus, suggesting that one vestibular system is sick. Again, my name is Ed Sloan. I'm Fern President and Board Chair. I have no financial conflicts. Please go to our Fern.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo, and follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, Fern.org. Or send us an email, fern.org@gmail.com, or you can comment here on the YouTube channel. Thank you and have a good day.